So today we will be working on our kettlebell swing. So today our muscles that are going to be in use, we're going to have our pectoralis major, our deltoids, trapezius that are back here. We're also going to have our glutes, rectus femoris. We're also going to have our hamstrings are also going to be worked, vastus medialis. We're also going to have our gastrocnemius and our soles that will be getting worked on today. Some of the joints also going to be in action during this workout will be our ankles, our knee, our hip, our spinal, and our shoulder joints. All of these all in combination help us achieve our phases here and through our legs. And also this exercise with the kettlebell is also gonna go through our sagittal plane. Imagine I have an imaginary line coming through at about hip, because we will be doing flexion coming through and then extension coming right back up with it. One key note I do want to make a note of is we do not want to be in hyperextension. So our movement is here, coming back up, but we do not want to be back here. When we're back here, we're putting a lot of strain on our back, and we do not want to do that. So for starters, we're going to want to stand in anatomical position. Your hands are going to be prone, and the kettlebell will be anterior to you. Make sure you have a kettlebell that is the appropriate weight for you. You do not want something that's going to be too heavy that is also going to cause injury. Next, you're going to want to plant your heels and engage your core. Planting our heels down, we're going to engage our core as we come down and pick up the kettlebell. Once we do that, we're going to swing the kettlebell posteriorly. We're going to bring it back up anteriorly to our body. When we're bringing it back up, we're going to want to make sure we're standing tall and making sure that kettlebell is at about chest height, and it's going to kind of try to maintain it medially. So I will demonstrate in a moment, but you'll notice when I bring my kettlebell back up, it's going to be at about chest height. We do not want to bring it up here. Just for safety reasons, we're not going to bring it up here today. Just trying to keep it medially and at about chest height. And then next, we're going to want to keep our arms straight. This is going to be during the eccentric movement out here, nice and straight, nice and loose. As we're swinging the kettlebell, we're going to want all the weight and momentum of the kettlebell to do the work. It's going to bring our hands up, and when we're coming back down, it's going to let it do all the work. Relax the shoulders, come back down. And then we're going to use our hips and quads when we're back down here, and during the concentric phase, we're going to want to use our quads and our hips to kind of build that momentum to bring it back up. So now I will quickly demonstrate how to do this. Grab our kettlebell, start posteriorly, bring it anteriorly, chest height, keeping it medial, down, through, making sure those quads are doing the work. Notice how I am letting the weight do majority of the work, coming through, and we're just gonna keep doing this for however many reps and sets you're working for today. One key note is when we're coming through to finish, as you'll notice in a few seconds, we're gonna wanna gradually slow down and place it on the ground and then go into our recovery. You do not wanna stop mid-swing up here to bring it down, because again, it will cause injury. So we're gonna wanna keep it, as we're coming back down, slow it down and try to place it on the ground instead of being up here.